Philadelphia Suboxone Clinic. If you're living in Philadelphia and suffering from opioid addiction, don't give up hope on recovery. Plenty of treatment options are available to you. Suboxone clinics throughout the city offer various treatment options for addiction recovery. Whether it's counseling or medication-assisted treatment, these facilities provide short-term and long-term care that can help alleviate your symptoms and get you on the road to successful recovery. This video will discuss Philadelphia Suboxone clinics and how you can take advantage of their services. We'll discuss topics such as opioid abuse and addiction, what Suboxone is, how Suboxone clinics work, tips for choosing a clinic, and finally, how to find a Philadelphia Suboxone clinic today. Let's get started. Before we dive into the details, let's first discuss opioid abuse and addiction. Opioids are potent drugs that can significantly alter a person's behavior and cause severe physical dependence. Opioids are used to treat chronic pain, but when misused, they can be dangerous and addictive. When taken in large doses or for extended periods, opioids can lead to addiction and overdose, which is why medication-assisted treatment with Suboxone clinics is so essential. People with opioid use disorder (OUD) experience a range of physical, mental, and emotional symptoms that are difficult to overcome without proper treatment. They also experience withdrawal symptoms when they try to stop taking opioids, making it difficult for them to quit. Suboxone clinics are designed to help people with OUD manage their withdrawal symptoms and learn how to live without relying on opioids. Suboxone is a medication that helps reduce the cravings and withdrawal symptoms associated with opioid addiction. It is a combination of two drugs, buprenorphine and naloxone. Buprenorphine helps to reduce cravings, while naloxone blocks opioids from affecting the brain, helping to prevent relapse. Suboxone comes as tablets and films. It is prescribed by a doctor at Suboxone clinics and taken daily to help manage withdrawal symptoms and cravings. Suboxone is used in medication-assisted treatment or MAT programs to help people with opioid use disorder recover from their addiction. It is a safe and effective way to manage OUD when taken as prescribed. Suboxone combines buprenorphine, an opioid partial agonist, and naloxone, an opioid antagonist. Buprenorphine helps reduce cravings and withdrawal symptoms by binding to the same brain receptors as opioids without causing the same high. It produces milder effects than full agonist opioids and helps reduce the risk of overdose. Because buprenorphine has a milder effect than full agonist opioids, it can allow people to reduce their opioid use to achieve sobriety gradually. It also reduces cravings so that people are less likely to relapse. In addition, buprenorphine is longer acting than most opioids, so it can provide more stable effects throughout the day. Naloxone is a medication that can reverse opioid overdoses and is an integral part of Suboxone. It works by blocking the effects of opioids on the brain. So if someone starts to overdose, naloxone can be administered to help them stay alive. You can think of naloxone as a safety net. It's an integral part of Suboxone treatment because it helps protect people in case of accidental overdose. In addition, naloxone can help reduce cravings and withdrawal symptoms associated with opioid misuse, which can be a significant barrier to recovery. Suboxone clinics are designed to help people with OUD manage their withdrawal symptoms and learn how to live without relying on opioids. They can provide medications such as Suboxone, counseling, MAT, and other resources to help people quit opioids and stay sober. At a Suboxone clinic, the first step is usually an assessment to determine the patient's treatment needs. The doctor will ask about the patient's medical history, substance use patterns, and other relevant information. It helps create an individualized treatment plan tailored to their specific needs. Once a treatment plan is established, patients can start taking Suboxone and receive counseling from qualified professionals. Depending on the clinic, they may receive other resources such as 12-step programs, group therapy, or family counseling. These can all help to support patients in their recovery and provide them with additional tools for success. Some Suboxone providers even offer virtual telehealth Suboxone services for their patients. Finding a Suboxone clinic online is easy, thanks to SuboxoneDoctor.com. Our website provides an up-to-date list of Suboxone clinics in the United States, including Philadelphia. You can search for clinics by city or zip code and get detailed information about each clinic, such as an address, phone number, and services offered. You can also use our website to find out if a clinic is accepting new patients, if there are any restrictions or special requirements for treatment, and what forms of insurance they accept. When choosing a Philadelphia Suboxone clinic, it's essential to consider the type of services offered and the quality of care the clinic staff provides. Here are a few tips to keep in mind. Make sure they are certified and trained in delivering Suboxone treatments. Ask about the services offered, such as counseling, group therapy, or family support. Research the doctor or healthcare provider who will be leading your treatment. Find out if the clinic accepts your insurance. Ask about any additional fees for lab tests or other services. Read reviews to get an idea of what other patients have experienced at the clinic. If you or someone you know is struggling with an opioid use disorder, a Suboxone clinic in Philadelphia may be the right option for treatment. With our help, you can easily find the right clinic and begin your journey to recovery. Visit SuboxoneDoctor.com today to find a Suboxone clinic in Philadelphia and get started on the road to recovery. We are here to help you every step of the way.